All right. Thank you all for your time today. This is the pre-proposal conference for the youth-focused micro-community operations request for proposal. And I apologize, I don't know what happened. This used to be in a brighter white and somehow it is now in gray. So I apologize if there's any issues seeing it. The good news is I will be reading these verbatim just for anyone who's listening in also, or chooses to listen in later on. For attendance purposes, if you don't mind putting your name and title and organization that you're representing in the chat feature. This PowerPoint will also be available on the bid site. We ask that everyone mute themselves, and if you do have questions, please submit them in the chat function. So, all requests for information, clarification, and any questions must be emailed to the host procurements at denvergov.org throughout this process. As long as we can receive them within the time. So the deadline to submit additional questions after today is by tomorrow, by that 5 p.m. deadline. And then response to those questions will be submitted on Monday in an addendum. And it will be posted on Zengine. So schedule of events, we issued this on September 29th. Today, we are doing the pre-proposal conference. Tomorrow is the deadline to submit additional questions by 5 p.m. And responses will be, like I said, on Monday by 5 p.m. The proposal due date on this is October 20th. And we are hoping to have an award out by November 1st. So the purpose behind this, Denver is looking for an organization that will operate and serve a youth-focused micro-community for unsheltered youth experiencing homelessness in the ages of 18 to 24. The selected organization will provide site management and necessary support services that cater to this population. Specifically, Host is looking for a provider to utilize a comprehensive approach that addresses immediate needs to stabilize youth experiencing homelessness, provide housing navigation, benefit navigation and enrollment, full case management, referrals and coordination appropriate for physical and behavioral health services, and any other services that promote long-term stability and well-being. This integrated approach is crucial in addressing the complex and interconnected challenges faced by people experiencing homelessness on their path to stability. So the scope of work for this is providers must be able to complete the following: facility and or site management, so oversee the day-to-day operations and maintenance of youth-focused micro-community to ensure compliance with all building codes, health regulations, safety issues, staff management and training to recruit, train, and supervise 24/7 micro-community staff, including subcontractors or in-house security, facilities, pest control, and other personnel. Client intake and management system to conduct an intake process in the Homeless Management Information System, HMIS, for new residents, ensuring they receive necessary support services under the program. And manage site safety and security to establish and enforce security protocols, ensure the safety of residents and staff. Manage health and hygiene to implement and enforce health and hygiene standards to prevent the spread of illness within the micro-communities. Ensure access to clean drinking water, bathing facilities, and laundry services for residents. Collaborate with community stakeholders and partner organizations to foster positive relationships with the local community to reduce any negative impacts and address concerns. And then financial management in developing and managing the micro-community budget, including tracking expenses, reporting and documentation to maintain accurate and up-to-date records of micro-community operations in HMIS for resident data services provided and exits from the program. And collaborate with the city representative or representatives to notify and address any critical incidences on site. Scope of work continued to provide physical health referrals to providers for medical, dental, and vision services, provide behavioral health referrals to host coordinated providers for mental health, substance misuse, and harm reduction services, provide benefit navigation, enrollment assistance, and general access to basic needs to help stabilize youth, collect and enter and use required data to make policy decisions, provide reports, and adhere to host data and reporting compliance. So under this procurement, the youth-focused community, micro-community outcome goals are as follows. Provide case management to 100% of residents annually, connect 80% of residents to permanent or more stable housing, assist approximately 90% of residents gain or increase access to benefits, and assist approximately 50% of residents to connect to behavioral health, substance use, and physical care. Proposals should reflect, and these are the minimum qualifications, so proposals should reflect extensive knowledge about and experience working with youth experiencing unsheltered homelessness in Denver. Proposals should reflect a deep understanding of the unique needs that accompany the target population. Proposers must provide supportive services to residents. If services are not directly provided, the proposer would need to please explain how those required services would be provided using other resources. So the budget. Funding availability through this comes from federal funding. Proposers are strongly advised to become familiar with uniform guidance, generally accepted accounting principles, and overall requirements to successfully manage federal funds before submission of a proposal. Host encourages providers to submit a budget which reflects the operational needs of the program. Subsequent budget periods are subject to availability of funds, program authority, satisfactory performance, and compliance with the terms and conditions of the award. Data requirements. So providers will be required to set up an HMIS. Vendors who do not have access to HMIS will be provided with training necessary to utilize the system. The selected providers will be required to enter and record all program data into the HMIS system, including but not limited to clients' demographic information, enrollment, provision of services and supports, case management, and exit information. The selected service provider shall abide by both COHMIS policy and data quality standards established and adopted by the Metro Denver Homeless Initiative, MDHI, Continuum of Care, COC, for Metro Denver. And the selected provider will be required to submit quarterly program narrative reports and HMIS data quality reports to host via the host program community. Host will provide service provider with training and login credentials. And the quarterly program narrative report will include program successes, challenges, qualitative report, program spin down, etc. In rare situations, service providers may be required to submit supplemental reports. Supplemental reports may be required when HMIS data and program narrative reports are not sufficient to demonstrate program impacts and outcomes. So a requirement for all contractors with the city for the certificate of insurance provisions are as follows. So insurance, workers' compensation, and employers' liability. There are waivers for sole proprietors, commercial general liability, sexual abuse and molestation exclusion language. So any contractor working with youth and or vulnerable populations will require same coverage as a part of the contractor's commercial general liability coverage. Business automobile liability. Once again, there's an exception for sole proprietors, cyber liability insurance, and then any contractor responsible for retaining personally identifiable information will be required to have that. Technical requirements. So in addition to responses to the questions and the budget, respondents must provide the following documentation: the diversity and inclusiveness form under Executive 101, proof of registration with the Secretary of State, accounting and audits as applicable, sample contract, just certify the sample contract, and then anti-discrimination policy, certify and provide any written anti-discrimination or non-discrimination employment and service policies if existing. So for evaluation criteria, the areas of review are agency capacity and experience, proposed services, equity and diversity, response to the city's proposed questions, technical review of proposal requirements, proposed outcomes, budget, program budget plan, response to the city's proposed sample contract provisions in the contract certification, and other requirements as applicable. No weighting relative importance of criteria is intended or implied by this list. And now to the important part, questions. So questions will be accepted once again till the deadline of tomorrow by 5 p.m. All questions and answers will be posted in the addendum. And then submission of proposals for the solicitation may only be done electronically through Zengine. Please submit them through the Zengine website, and that is also linked in the RFP itself. So, for the time remaining, you may type your questions into the chat function, and we will attempt to respond to them. Also, if later on, once again, if you have additional questions, please submit them to the host procurements at denvergov.org. And then any changes to the scope or any sort of notification will be via an addendum as well. All right. Hey, Cole. Midori and Cole, do you want to introduce yourselves really quickly?
Hey, Caitlin. My name is Midori Higa. I'm the Director of Homelessness Resolution Programs at Host. I don't think we've met before, but nice to meet you.
Good to meet you as well.
Yeah.
Hey there, I'm Mayor Johnson, Senior Advisor on Homelessness Resolution. Sorry I'm late.
Okay, good. We are just getting to the questions and answers portion, so perfect timing. And I just want to make sure that the person on the phone, if you want to just unmute yourself, and if you have any questions.
I think it's just Evie. Not just Evie.
Sorry.
Yeah.
Okay. All right. Well then, Caitlin, since you don't have any questions, thank you so much for joining today. And if you do have questions later on, please let us know.
Wonderful. I'll certainly reach out. Thank you all so much.
Yeah, thank you. Have a great day.
Bye.
All right.